So bridges is an exercise for the glutes, for the hamstrings, and a little bit the quads. Some people feel it in their back sometimes. So what you want to be careful of is the form, really. You know, if it's both legs, they should be doing this. Their pelvis should not be flattening before they go up, unless that's what the therapist wants. And their pelvis should not be arching a ton before they go up. Usually there's a form of that if they feel it in their back. Either that or their back is just very, very sensitive. So usually what I cue is just tightening the stomach a little bit, trying to keep your spine straight as you push your feet into the ground to lift up your pelvis. There should be no buckling, because that's generally when they feel the pain in the back, if there's movement at the back when they do it. But this is kind of what you're trying to do ideally. And it should be working the glutes, hamstrings, and the quads work a little, but ideally it should be glutes, and hamstrings are secondary, and quads are really secondary. And so another thing to focus on that sometimes I'll cue patients is try, if they're not feeling it in their legs at all, or it's all in their quads, try to imagine pushing your heels this way, like driving them into the floor, or picking up your toes, driving your heels into the table. That generally will get the butt a little more, or the hamstrings a little more. If they're still not getting it, but they're able to do it pretty well, you might want to put a band around their knees and have them push outwards, because that'll generally, when you push outwards into a band, you're performing hip external rotation and hip abduction, which is the gluteus medius muscle. So now that kicks in your gluteus medius, which then sometimes helps that gluteus maximus work a little bit more when you're doing the bridges. That's another strategy you can do with squats or wall squats, or even the leg press. If they're working that, if they're just all quads and they're not using their butt at all, or they have a really weak glutes, you might want to give them a band around their knees. Or if their knees like diving in a lot, you might want to put a band around their knees if they have the strength to push into it, because then they're pushing outwards into that band, and the band's trying to pull them in. So they're having to fight against temptation to do what they like doing in general, putting their knees together, and do the exercise. So it really helps engage these while you engage these, which then can carry over to functional tasks. So another thing with bridges is you could do single leg bridges. Research has shown that single leg bridge is supposed to work the gluteus maximus pretty well in regards to other exercises. It's supposed to be a pretty good one for gluteus maximus. But you'll find some people really don't feel it in their glutes. They feel it all their quads or their back. So just because the research shows it doesn't mean it's accurate, but it is something to consider. So this is one way to do a single leg bridge, just like this. Another way that some therapists like is going up with both, then straightening out one leg, coming down, and coming here. Up with both, straightening one, down, down. So I would ask the therapist which they prefer in terms of single leg bridges, because they're both kind of a single leg bridge. And they might even want an eccentric, where you go up with both, lift your leg up, and come down on one. That would be kind of an eccentric single leg bridge. Up with both, lift your left, down on the right. So that would be right leg eccentric single leg bridge. And that's bridges. Another way to do bridges would be with a Swiss ball, like a big blue ball or an orange ball that the legs go on top of. You push your knees into it, and then you lift up your bottom and do bridges like that.